Hi, my name is Sam Guild. I'm with the Skin Cancer Education and Research Foundation. I am so excited to be having this webinar today. This is the first webinar patient symposium that we have held. It's going to be the first of many, and I am incredibly honored to be doing it with the Cleveland Clinic. I've worked with you guys, in melanoma, and now we will be doing it in non-melanoma. So thank you so much. A couple of quick logistics. So we have a Q&A section. Always happens as soon as we go live. And do you mind taking over? I'm so sorry.
Oh, okay. Yes. If you are joining us via Zoom, then we would invite you to put comments in the comment section. Please tell us where you're from. Tell us about yourself if you'd like to, but we know that you're going to have questions for our panelists. And so what we need you to do is there is a tab and you'll put your questions into the Q&A session, and we will have a question and answer period at the end of today's presentations, and we'll get to as many of those as we can. If you are joining us through Facebook, then you can leave those questions in the comment section and we will transfer them over to Zoom. And with that, I will pass this over to Dr. Fontaine and let her start our inaugural non-melanoma symposium.
Good evening, everyone, and thank you to Sam and Anne for the introduction. We're really excited at the Cleveland Clinic to kick off this symposium, so Living with Non-Melanoma Skin Cancer. We really want to focus today on non-melanoma skin cancers, so specifically squamous cell carcinomas of the skin and basal cell carcinomas of the skin. We'll do a little bit on Merkel cell carcinoma because it is rare, but it's radically changing, and it's kind of cool to hear that story. What is this symposium about? There's a lot of symposiums. We've heard a lot about melanoma in the skin cancer world. So I think it's really cool that SCORF is putting this on to really address non-melanoma skin cancer. I mean, this is the most common cancer in the United States. That's 1 in 5 people, or 1 in 5 Americans that are estimated to experience skin cancer and to have to live with the treatment and management. And it can be really simple. It can be really complex. So we have a fantastic panel of skin cancer experts here. They are amazingly knowledgeable, but also amazing clinicians. And I would get treated by any one of these people in a heartbeat. But they'll share their insights and experiences. They'll give you practical information because this symposium is really for you. For people with skin cancers, for people who are caregivers of people with skin cancers, people who just want to learn more. So we'll try to do as best we can to give you all the information that you need at a time when you need it. So we'll talk about all the strategies from diagnosing, managing, prevention. We're going soup to nuts. We're gonna go, look at prevention. We'll look at severe disease. We'll look at it all. Okay, so thank you all for joining us today, and thank you for the speakers for volunteering their time. We're going to go slightly out of order for those of you who are following the agenda, just for our speakers.